Hi class, my name is Jessica Hense and this is my professional portfolio. To start off, we're going to go over my table of contents. So we have my resume, certifications, examples of my work, 5-year professional development plan, and my reflective summary of my BSN program. To start off, we will take a look at my resume. So I used this resume when I first got hired at Lakeland Regional, but I have tweaked it to basically gear it towards a more intensive ICU type job. So seeking a position as an intensive care nurse that utilizes communication skills, critical thinking, and extensive experience with medical practices. So I started my career at Lakeland Regional as a medical surgical nurse, and I started as a bedside nurse, and I have recently in the last year switched over to a team leader type position. So I included both of those on my resume. And for education, I made sure to add my bachelor's on here, which I will be completing in the next couple weeks, as well as my skills, my BLS certification, and my NHI stroke education. And I know that for the critical care type setting, I would need to go back and get my ACLS as well. So also now we'll go over my certifications. So we have the QI 101, and these basically I used to help guide me for my framework for my project. I had completed these previously in the past, but I just feel like with this project I really utilized them more. It kind of helped provide me with a framework to participate in my Plan, Do, Study, Act project. So I completed all of these. I kind of went over them. I read all the material to try and help, educate myself further to be able to conduct this project. So those are my certifications. Next we will go over examples of my work. We have my PDSA project, which I completed. I feel this was the biggest accomplishment in this program. I shadowed Jerry, the clinical nurse specialist. We decided that end-of-life discussions was something that novice nurses could use assistance with. So basically I provided each novice nurse with an anxiety rating scale. We used the Hamilton scale to help see how much anxiety novice nurses had prior to holding an end-of-life discussion. I then provided them a handout of education that they could utilize while initiating an end-of-life discussion, and then I reassessed their anxiety level a week after they had actually held an end-of-life conversation to see if the education was enough to basically decrease their anxiety levels. So the Hamilton Anxiety Rating Scale basically had questions that each nurse would answer, and then each question you basically scored between a 0 and a 4 to basically give an overall rating scale at the end. And then I used 5 seasoned nurses and 5 novice nurses at Lakeland Regional's palliative care unit. So to collect data, I used the anxiety rating scale to kind of guide my framework to see if the education alone would decrease their anxiety. So novice registered nurses scored an average of 27, which was moderate to severe anxiety, while seasoned nurses, they scored less than 10, which was below level. So I used the spike method as the backbone for my project and encouraged novice nurses to utilize it. So S, for the beginning part, you want to choose a setting that provides quiet and privacy. You want to hold your calls in pagers, and make sure that when you deliver the bad news, you are demonstrating good listening skills and focusing your attention on the patient. Then before diving into the plan of care, you must establish how much the patient knows and what their perceptions are about the medical situation. So then during the invitation or information step, you want to determine basically by directly asking how much and what kind of information the patients feel will be helpful to them, while also taking into account their learning styles. And then knowledge, you want to use the stage is where you actually share the bad news. So it should be introduced gently, like by saying, I have some serious news to tell you, or I have some bad news, basically to help introduce it. For empathy, the key is to acknowledge emotions and reactions. So I wish the news was better, or this is obviously distressing news. basically to help convey empathy. And then for the last part, you want to basically summarize or strategize the information that's presented in a language that the patient can easily understand and develop a plan for further intervention. So you ask questions like, does this make sense? Are you clear about the next steps? Basically, the Sparks protocol was used as a plan of action that can provide a structure for this difficult decision or difficult discussion, and it also helps support both parties. So basically, when I analyzed my data and went over everything, I feel that education alone is not enough to assist a novice nurse in holding end-of-life discussions, and I feel that basically they could benefit by shadowing a seasoned nurse, just because that would provide them more feedback, and many seasoned nurses have already participated in end-of-life discussions, so these nurses view it as less taboo than a novice nurse would. And basically, based off the rating scale, it was beneficial in novice nurses to use a more hands-on approach. So basically, the next step for my project, I would want to identify some seasoned nurses that are comfortable with being mentors, so that they could help with these seasoned novice nurses to try and help educate them even further. And then the education, that I would still use the education. However, I feel like the education was not successful. So the educational handout, I would like to modify it and maybe make it more scripted for questions that could be utilized for novice nurses during the communication skills. I enjoyed doing this project and would recommend completing doing this in the future. So on here I have provided, this is the educational handout that I used. So I had goals of end of care, the Spikes protocol, but I kind of made it more easy to read, but I feel like the Spikes protocol, I would want to go more in depth with that on my educational handout. And then I also provided the anxiety rating scale. So less than 17 is mild, 18 to 24 is mild to moderate, and then 25 to 30 is moderate to severe anxiety. And then this is the questionnaire that they were given pre and post end-of-life discussion. So for my Pro Nursing Excellence activity log, I did get to experience multiple different things while I was following Jerry, and I definitely met all 8 of the student learning outcomes and felt that I could effectively communicate with everyone, and I feel that through this shadowing experience, I have learned how to effectively communicate with patients about end-of-life care. And then I did my advocacy observation report. So I went to an ethics committee meeting, which I felt was a great opportunity for me because it's not something that we see on a daily basis or get to attend on a daily basis. And basically it's just the goal for the meetings is to advocate for patients' rights and safety. So I felt like it was the perfect opportunity to learn about the method for ethical decision making, as this can be refined and used in nursing practice when addressing ethical dilemmas. And so they discussed quite a few things, and specifically for this one, they did go over how the Advanced Directive and Living Will, they want it to become more of the go-to paperwork for the hospital. And so I thought that was kind of interesting since I did my project on end-of-life care, and just learning about how important it really is to have an Advanced Directive Living Will and knowing your patient's wishes. And then how much more satisfying it is for us as nurses to be able to carry out what your patient actually wants rather than doing all these things that maybe the patient isn't even wanting to continue with. So then next I have my 5-year professional development plan. So after completing the BSN program, I plan to continue working as a team leader, but I also want to start studying to take my Certified Medical Surgical Registered Nurse exam. And I hope to complete this within the next year. And then in August of 2018, so next month actually, I registered to educate myself on the options available for a master's program at University of South Florida. And I'm hoping to possibly register and start by the end of next year. My goal is to complete this within the next 5 years so that then I can begin searching for a career as possibly a nurse practitioner or whatever option I decide to go with, but that's kind of where I'm leaning towards. I also did a leadership paper or a career goal paper in my leadership class, and it kind of helped me to identify what my career goals were, and then it kind of also helped to identify the limitations and barriers that are associated with each. and then kind of how I plan to monitor my progress and how I plan basically to achieve these goals. And so I thought that was kind of interesting, with the 5-year development plan as well. And then I also did my reflective paper. So I did that, and basically I did it on my personal and professional developments as they are intertwined, however they are different. So through professional development, you can identify, what you hope to accomplish and how to obtain it while evolving your skills to find resolutions. But to be successful, you must be efficient in skills necessary for the roles while identifying needs within their role to help grow one's personal development. So I felt like I met the student learning outcome number 2, exhibit skills in nursing leadership to promote effective communication, thus building collaborative relationships. As communication is a large part of the healthcare industry, I feel like through my shadowing experience, I've built new ways to communicate with patients and kind of learned ways how to hold end-of-life conversations or talk about topics that are a little bit harder that maybe, might be a little bit harder to have. I feel like in this one, though, I do have some area of opportunity as I am very, I guess I'm hesitant to have conversations when it comes to conflict. And as a team leader, obviously, this is something that I have to do. So I'm hoping to kind of build on that and be able to better hold a conversation with someone when there's conflict involved. Another student learning outcome that I felt like I did well with was the cultivates a spirit of inquiry by using scholarly evidence and published theories or frameworks to implement changes in nursing practice. So the classes helped me develop the skills in searching for reliable evidence-based scholarly articles that I can use to make changes within a unit. I hope that I can continue my Plan, Do, Study, Act project by implementing on the unit that I work for, as well as, maybe throughout the hospital, maybe on the oncology floor as well. I just feel like we have a lot of areas of opportunity when it comes to that. The other student learning outcome that I really enjoyed was the values continuous learning that empowers personal and professional growth, as I hope to continue my education by achieving the certification as the CMSRN within the next year, and then also continuing on to get my nurse practitioner license. So basically, as a team leader, I hope that I could better serve patients and families through my continuing of education, developing in my unit, and by addressing difficult conversations head on. And I feel like through the shadowing experience, I have seen the benefits of identifying goals of care for patients and their families. So through this experience, I feel like I've definitely grown as a nurse, and I feel like this class has really helped to build on my skills and make me more of a holistic nurse for my patients, and kind of gives me a broader outlook on patient care, and that it goes beyond just medications and diagnosis, and making sure that we know what our patients want and that we're following through on their wishes, so that we can do that. And then I hope to begin reflecting more on my nursing practice, as I feel this is something that I could improve upon, so that I can better understand my values, assumptions, and so that I can kind of even make myself even more of a better nurse for patients, as well as a better leader for my staff. So thank you for taking the time to watch my video. This class has been very enjoyable for me, and I hope everyone has a great rest of the class, and good luck with your future endeavors. Thank you.